We ought to have a debate about national health care and how we solve the problems in health care in this country. There is a way to solve it. It's to make sure everybody in this country has access and give them the freedom and the power to choose what is best for them rather than us tell them what they have to have. And that's the debate we ought to have. This is a farce. This debate is a farce. It's a farce about saying we want to cover more children when we're really taking children who are already covered and putting them under a government program and then charging those children's kids for the cost of the program. That's what we're really doing. It's not about caring for kids. It's about lying to the American public about what this program really does. So I don't have any hard feelings about the fact that people want to have national health care and a government-run program, but let's have the debate about what it really is and not have a debate demeaning the president when he finally stands up and says, you know, we really have an obligation to the next few generations to start doing it right. And finally, he's starting to do it right. And now we're saying he's immoral. And the 10 million kids, 5 million already have coverage. And we're going to ask the American taxpayer, in spite of what we're doing, in spite of the fact that we borrowed $434 billion, we're going to ask them, we're just going to load that on you. We're going to load this on you. They already have coverage. They already have immunizations. They already have well child care. And we're going to add that to the American taxpayer. But you know who that taxpayer is? That's that child's child. Because we're not going to pay for it. We're going to refuse to be responsible. We played the game on pay-go on this. The great pay-go rule where we now bastardize our own ethics to say we paid for something knowing we didn't. Because nobody in this body believes this is going to go to $700 million 5 years from now. Nobody believes that. Everybody knows that. So everybody knows that we're telling an untruth to the American people about the true cost of this program. I care a ton about my patients. But I also can care enough about this country to be able to speak the truth about what we're doing. And what we're doing is absolutely untruthful in how we characterize the spending on this program. You can debate that. I'll debate that all day with anybody up here. Those numbers, this body knows, I know our numbers. And the numbers on this bill are untruthful. And so what we ought to say is we think we ought to expand the S-CHIP program, and it costs $121 billion. So let's have a debate about what it really costs. That's why the president says we shouldn't do it, and we shouldn't go to 300%, and we shouldn't have adults on a program where in many states it consumes 75% of the dollars. I will readily grant you we have a big problem with health care in this country. And one of the major reasons we have a big problem with health care in this country is government-run health care programs that drive the cost and the overutilization in many areas where we can't function properly. Washington has an 11% approval rating for a very good reason, because we don't deserve to be trusted because we do exactly what we're doing on this bill. We are lying to the American people about what it costs, who it will cover, and how it will be delivered. Now, some of the other details of the bill are debatable, but those facts aren't debatable. And the American people, hopefully soon, are going to wake up to the dishonesty and the farce that we perpetrate on them as we debate these issues.